I'm Lizzie Dunklee. I'm executive producer of Health 2.0, and we're here in the Northwest at OHSU in Portland to talk about a lot of things, but one of the big things that we're talking about is the Health 2.0 Developer Challenge. The Health 2.0 Developer Challenge was originally built out of the Community Health Data Initiative back in June. And basically what happened there was Health and Human Services reached out to a bunch of companies, including Tim O'Reilly, Microsoft, Health Vault, Google, Palantir, and said, here's some data, we want you to, in the period of 2 weeks, build something around it. And then at the Community Health Data Initiative, which was in the first week in June, those companies released their products to the world. And the government looked at all of the great things that were built out of it and said, hey, we want to do this better. We want to take this to the masses. And so we're here today to talk about a couple of companies that are in fact starting to build things around these challenges and see where we can go from there.
I'm Frank Illey, co-founder of HealthSAS. I'm also the manager of Health 2.0 Northwest. I actually met Matthew Holt at the HIMSS conference in 2009. We started talking about developing a Northwest chapter here. I volunteered to do it, and 15 months later, here we are. We're here this evening to bring together several different industry experts and talk about how the patient-centered medical home converges with telemedicine, mobility, PHRs, and EMRs. The Health 2.0 Developer Challenge is sponsored by Health and Human Services. HealthSAS is actually participating in the Practice Fusion Developer Challenge. Tonight we'll give a brief demo of HealthSAS PHRs, and we'll also talk about the industry convergence as a whole. We're also a Health Vault, Microsoft Health Vault, and Dossier partner. We'll be launching our PHRs on the Health Vault and Dossier platforms in Q4 of this year. Our personal health records to date are pain PHR and diabetes PHR. We will be launching SportsMed PHR and breast cancer PHR in Q1 of 2011. Wow.
I'm Bill Hirsch. I'm the chair of the Department of Medical Informatics and Clinical Epidemiology at Oregon Health and Science University. We're one of the largest and well-known biomedical informatics programs around the country with a lot of focus on all this new interesting health information technology work going on. We're quite involved in the various aspects of the high-tech program, which is the Health IT program under the stimulus package, the ERA legislation, and being an academic institution, we're quite involved in the workforce development program, which is predicated on an anticipated need for as many as 50,000 more professionals who work in health IT. And so we have two large grant projects, one of which is to develop curricula for a large number of community college programs that will educate actually the bulk of these professionals, mainly individuals coming back to school already with healthcare or IT backgrounds. And then we also have another grant that will fund students in our graduate level program, which is mostly an online program, although we also have students on campus, and they will be more of the leaders and higher end workers in the workforce that's needed for health IT. I was actually contacted by the folks from Health 2.0 who are interested in setting up a local, I guess you would say, chapter, and we, as you know, host these events on various topics here, so we'll now throw Health 2.0 into the mix.
Hello, I'm Jeff Brandt with Communication Software Inc. I'm actually a participant, at least my company is, with the Health 2.0 Challenge that is being offered, that's going to be in San Francisco on October 7th of this year. We're actually presenting a system that is going to interface with Practice Fusion, EHR, and providing connectivity over wireless devices. And I decided that would be a great thing for us to participate in, since we have a mobile PHR and a server device that actually connects EHRs, PHRs to mobile devices.
Hi, I'm Sue Woods. I'm at the Portland VA and work for the Veterans Health Administration as the Associate National Director for eHealth under Patient Care Services. I'm also on faculty at OHSU. So today I'm just talking about engaging consumers and patients in their own health and healthcare through the use of patient-centered, patient-facing health IT, integrating these tools into our clinical care, into our workflow, to get meaningful use for patients. The VA is expanding their functionality of their personal health record. It's called My Healthy Vet. But I'm involved in getting more clinical adoption and integration of the PHR. We're using and piloting secure messaging in multiple sites across the U.S., and I've been involved in that. So just really focusing on clinical adoption of patient-facing applications.
Hi, I'm Dishman. I'm the Director of Health Innovation and Policy for Intel Corporation. And I'm here tonight to talk about moving healthcare to the home. Everyone talks about the patient-centered medical home as an idea, but I actually want to talk about it as a place and how we use information technologies to actually do care in the home for chronic patients and just about everybody. I am basically here trying to think about how the Pacific Northwest could and should lead on personal health technologies, so that's my focus. So I'm a weirdo at Intel. I'm a social scientist. I run our health policy effort, but also our research efforts, and we've studied about 1,000 elderly households over the last 10 years, trying to understand their needs and how information technologies could help them manage their chronic disease from home or stay independent even as they age. And so Intel's got a business group, and we're really focused on trying to get those technologies widely disseminated out in the world.